Kern Health Systems right now, as most everybody understands, has a huge reserve money sitting there, close to $100 million. Obviously, a lot of pressure being applied on them to use those funds either for the plan or the state will look to probably go after some of those funds. We were asked to attend this particular meeting to address how Kern Health Systems might be able to help us enhance the level of services that we provide to their members up here. We were asked, Chet and Greg Davis and myself attended that meeting with a number of ideas that we came up with. Obviously at the time, our first and foremost concern was replacing the physician in the rural health clinic. And that was one of the things that we were asking for some support from them, was to probably help with some of the recruitment needs associated with that, or identification of a physician who might come up there. At that meeting, it was actually shared with us that this had actually been a topic of one of their board meetings before, where they had actually said that they had actually approved funds to use to help us in that recruitment. This week we have forwarded a letter to Kern Health Systems asking to assist us with the repayment of a portion of those recruitment fees that we used to recruit Dr. Montez. Literally a week after the meeting, Dr. Montez came to us through another recruitment firm. So we had another recruitment fee over and above what we had committed to Merritt Hawkins. And so that is the amount of money that we've actually asked them to cover for us. And so I was asked to put that in writing to them and he will present that to the board for their consideration, since the board had already addressed the issue that they would in fact help us with that. So we're hoping we can get some of that back. This kind of created another issue with everyone to how these funds could ultimately be used. About a week after our presentation, there was another board meeting at Kern Health Systems where Senator Rubio came and made a presentation to the Kern Health Systems board requesting approximately $20 million in funds for Clinica Sierra Vista and National Health Service clinics, and some monies for KMC. 12 million of that 20 million was earmarked towards Clinica Sierra Vista, or not Clinica Sierra Vista. Yeah, Clinica Sierra Vista, right. There's your Sienna. They're way too close. And part of that money were to be used to build new clinics and enhance their older clinics and remodel and those kinds of things and so forth. And so the question was raised, what about the other end? The reason they were asking that was because those were considered to be the safety net providers for Kern Health Systems. Our issue, not only from our rural health clinic and from our hospital, Tehachapi, and they have 3 rural health clinics in Delano. We all basically said, listen, we all are here serving needs of their patient population out here in the rural areas, and therefore we are just as much a part of that safety net as well. And so we are going back and looking at other possible ways, I mean, some more substantial ways that they may be able to provide some assistance to our hospital out here and to our clinic to enhance the services. We're looking at certain equipment that their point is they want to keep their patients up here. They really want to minimize the travel for their patients down in Bakersfield, so they're talking about what equipment could we need here at the hospital that might prevent them from having to get out to Bakersfield for certain testing. Obviously, the infusion therapy was one of the things that we had on our list that we spoke with them about, possibly paying for those infusion pumps and so forth. So there is going to be some significant dialogue going on with this over the next month or two in terms of how we might be able to better take advantage of some of the assistance that they're willing to participate in. But clearly, I think there was, at their strategic planning meeting that they had 2 weeks ago, this issue came up in a big way as to why the critical access hospitals and the other rural health clinics were never included in that original safety net category. And so there's now some discussion about expanding that. That obviously, by regulation, they can only share those reserves with FQHCs and Kern Medical Center because that was what was set up when Kern Health Systems was established. And that was primarily because those were the people who happened to be sitting at the table at the time that this thing was drafted. And so clearly there was some oversight that there were other safety net providers that needed to participate. So there's a lot of discussion going on with Kern Health Systems right now to see how we can certainly participate, and that there might be some things that they can do to help our community in a much bigger way. So we're working very closely with their board on that.